Can you just leave the street
No,
there?
because they had-
We're doing it, Sam.
They've got a lot of options right eye. Which is left eye was struggling to
that close to me. So some businesses are quite confused, and this was the problem we were having actually with bars and restaurants over the past couple of weeks, that they hadn't been told to shut, but the number of people walking through the door had just, you know, fallen off a cliff. So they weren't making any money. One restaurant I spoke to was operating at 10%.
It just needs to be done every day, then it will suck and
simply wasn't sustainable.
Have you any Vaseline?
All these fears about jobs going as a result of that. So actually a lot of hotels and restaurants and bars have welcomed this advice.
Just wash your hands, make sure you get a clean one.
Of trying to get some help.
No, I don't read
scheme. And meanwhile, we have a completely different impact in other parts of the economy where you've got supermarkets and online deliveries racing to keep up.
So that was the substance of the press briefing that we've just had. Was there anything in that briefing that
got a bad position for him,
an exercise
Alright.
reassurance?
Right, the best way to do it, mate.
There was an effort to reassure people
I've
that
opened
there is food available for
I've opened it.
But I thought the fact they were emphasising that
Right, you put the Vaseline on my hand.
The Secretary of State
so that
giving out that message,
I don't put my
really
dirty
showed
hands
that
in there.
customers
Just put a bit on my hand.
haven't
It only needs a tiny bit,
retailers
that's
have
more than enough.
repeatedly said it over the
Get
past
some out.
week. You know, it's been over a week now that they have been blatantly saying, please shop considerately, don't leave the most vulnerable people without, and yet a week later the government is still having to remind people of that message. We do know that retailers say there is enough food and supplies, but their issue is getting it to stores, the logistics of it, the lorries and the people. So that is presenting a problem. The system is under some strain, and they are having to adapt, not just with the limits, but
it's a good bar.
you know, consolidating their opening hours or doing things a bit differently to meet this incessant demand.
Then you have the potential of elderly people being exposed perhaps to a virus if they are mingling with NHS.
Well, their line has been though that, you know, they just want to help those people get the food they need really. It's a sign of the times that you hear stories of those people coming into store late in the day after a long shift and they just can't get what they need. So yes, there are some
Right
unintended
then, George, come on, you goodbye.
Supermarkets seem to feel the priority is just to allow those people to get what they need. They are also saying to people, shop in a responsible way for health and safety as well. So they'll ask customers to stay a metre away from their staff, for example, which is, you may think that's very common sense, but you know, people obviously haven't necessarily been doing that to date. We've also had some shop workers have had a bit of abuse as well. So these situations don't always bring out the best in people, but the message is being repeated. People need to be considerate to avoid these massive spikes in demand, which actually nobody thinks will be sustained. The hope is that this is a temporary situation and that you know, online deliveries may see a spike in demand, but they're hoping this huge stockpiling we see particularly after government announcements actually won't be continuous for too long.
Because there was that figure that was staggering that was quoted, £1 billion more food or more shopping on people's shelves than there was a week ago. So that's got to be used up, hasn't it?
A staggering number that really. I mean, it probably doesn't average out at that much per person, but actually it's a huge amount of food that's gone out the supermarkets, sitting at home, and yes, you did hear, I think it was the British Retail Consortium, Helen Dickinson, saying you need to start eating some of that, don't go out and buy more now. So yeah, but very strange times we live in when one part of our economy is racing to keep up with demand, seeing huge demand.
So yeah, for hope now.
Supermarkets having to hire more staff, but at the other end, your pubs, your restaurants, gyms, leisure centres, demand has just completely fallen off. So very distorted impact on the economy.
Okay, many thanks.
Dodgy!
Our business correspondent. Well, coronavirus is already having an impact on
I'm not
all
going
of
to do
our
it again.
lives.
No.
What exactly is the virus?
Crystal, give me
Here's the
another one,
BBC's
then.
health and science reporter, Laura
I've got
Foster, to
Yeti.
explain.
Coronaviruses are a type of virus. The one we're all talking about is new, and it causes a disease called COVID-19. Now, most people will only be mildly affected by it, but it can kill. It starts by infecting our upper respiratory tracts, which are the airways from your nose to just above your vocal cords. You may develop a fever as your immune system starts to fight the virus, and a dry cough. That's one where you don't produce any phlegm. The virus can then spread to the lungs, making it harder for people to breathe, and it can cause pneumonia. In the most serious cases, people can die from the coronavirus. This is because the immune system can go into overdrive, and that can lead to organ failure. So we need to do what we can to stop this virus from spreading. As it gets into your body by breathing it in, or through your eyes and mouth, the best thing to do is wash your hands regularly and properly for at least 20 seconds. Catch your colds and sneezes in a tissue and avoid touching your face.
But that is very difficult, not
cough
touching your
and
face.
fever are the
If you've got
main
sleep in your mind, you need to get it out. You can't.
But what else should
Well,
you
look,
look out
wash
for?
your hands
If ever again?
first.
The
Then wash
two
your
main
legs.
symptoms of coronavirus to look out for are a
Like what you just
continuous
done,
dry
you
cough and
help it.
fever.
If you've got up
If
this
you're
morning,
sneezing a lot,
wash your
got
hands,
a
brush
runny
your teeth,
nose
wash
or
your
a headache,
face, then
you
you've
may
got
be
sleep in
ill,
your eyes,
but
but
you
you
probably
don't.
Well,
not got coronavirus.
to be honest, it
So how
shouldn't
high
bother
up
me
is
anyway.
the
I don't go
coronavirus
out.
one? And what exactly is a
I get topical.
Well, it's when you cough and there's no mucus or
Well,
phlegm.
you shouldn't be here then,
It's a
should you?
gluey substance in your tissue. And this is not the odd cough here and there. It has to
What
be
we should have done there, we should have just FaceTime each other. That's what we should have done.
Well, it might lead to that.
So how high
depending
a
on
fever is a coronavirus
what
fever?
situation I am.
Well, if you have one, you will know about
And
it.
that will everybody else have
Technically,
to
it's a
get an
body temperature
iPhone.
more than 37.8
FaceTime each other.
degrees Celsius, or 100
That's
degrees
including
Fahrenheit.
Paul
If you've
Davis.
not got a
He'll
thermometer,
start getting one if
basically
this
you will feel
happens.
hot, and your chest and back would be hot if someone touched you. If you have either of these
He is.
symptoms, then you need to stay at home for 7 days. And if you live with other people, they need to stay at home for at least 14 days. But if your symptoms get worse or they don't go away, if you live in the UK, then you need to contact the online NHS 111 coronavirus service. If you live abroad, then call your local healthcare provider.
Well, I'm joined now by our political correspondent Helen Catt. And Helen, just listening to that press briefing this afternoon, what did you make of it? Did you think that the minister was trying to reinforce messages that he thinks people just aren't heeding?
Well, these daily press briefings, they started, of course, on Monday, and they seem to fall into two camps at the moment. So you've either got days when there are these absolutely massive, world-changing announcements, which completely have a huge impact on the way we live and live our lives every day. And then you've got these other days which are more sort of updates, and today I think was more one of those. So we didn't get any new measures. We got instead this plea. I mean, George Eustace told us about some of the things the government has done in terms of relaxing competition laws to try and increase the supply of food. But what we got mostly from him was this sort of, he even said a plea. He was issuing a plea to people not to panic buy, which of course has been consistently the government message on this. They've consistently said there are enough supplies, you don't need to go out and stock up. He was just reiterating that today, and that I think will be interesting to see, well, does that actually have an effect? Because certainly others like Labour, for example, were calling for more government action on this. They wanted to see a clearer plan from government, if you like, on looking at items to restrict possibly, and looking at better communication and a more coordinated plan to try and dampen down that panic buying. Because as we know, if you've been to a supermarket in recent days, if you go in, there are empty shelves there as well. So today I think was just more of a reinforcement.
And the government clearly very keen for the supermarkets to be taking decisions about rationing. George Eustace, the Environment Secretary, very keen to distance government from any of those decisions.
Yes, he was very clear that in his view the supermarkets were best placed to decide what restrictions should be put on what products, and in a way that's reflective of the government's approach so far. If you think back to the beginning of the week, the original social distancing measures, they were quite reluctant to move to a point of saying we will close restaurants and pubs. It was more of urging people to behave responsibly and not go out to them, and we're seeing that a little bit here again, is this idea of urging people to modify their behaviour. Interesting today though that George Eustace was appealing to our better natures, bringing in the idea of the NHS worker at the end of a long shift who can't go and get food. So using that sort of persuasive to try and get people to change their behaviour rather than a government enforcement. But that will disappoint some who wanted to see perhaps a more government-led approach to this.
And Helen, after that enormous announcement yesterday by the Chancellor Rishi Sunak about a huge rescue package for businesses and for employees, there still remains this major problem for people who are self-employed and freelancers, that they can expect much less than somebody who is employed. Where are we on that?
Well, yes, I think that's rather dominated this morning, that while there's been a very good reception,
there still remains this major problem for people who are self-employed and freelancers, that they can expect much less than somebody who is employed.
It's in here! It's here!
Chris!
That's a phone.
Oh yes! Find it! It's here! Chris!
That one is.
No, it's come off.
That's the one. That's the one. That's what it sends. I'm talking about the funky fridge door.
What?
Talking about the fridge door.
Fucking Richie's there!
What's
that with
What's
that with the door?
That's the door. Fridge door.
I know! You said that's a fridge door.
Priest!
Door.
Priest!
Confused.
Priest!
Okay, now, man.
Priest!
Play.
What's that got to do with
Play.
the door?
Play.
Play what?
Didgeridoo.
I ain't got one.
Is that all fallacy, though?
Asshole!
Who's calling?
Ada? Yeah. Chiquitita, tell me what's wrong.
No, please, don't tell me what's wrong.
I will tell you what's wrong.
Oh, to go, you know.
Yes. How is it? Is it weak? Not teak? Chiquitita teak?
No. It's tea.
We.
What? Just explain to him the door's there, Michael. The door's there.
The door's there, you idiot.
That fucking bottle's there.
What?
Yeah, fucking buckles there.
No, is it empty? Michael, I'm making a drink, thank you.
Thank you.
No, ask him, is it empty?
Is it empty?
No, not me, him!
Oh, it's Francisco.
Yes, Francisco.
Is it empty?
Yes.
Right. Is it empty?
No, I've not drunk mine yet. Yes.
Now it's gone freaking dark.
Well,
You can't see it for a eye. Oh shit, he's back.
what?
He's just back.
He's right though, that door's gone.
Yes.
Michael
Did
can't
you?
see what I'm doing.
You did.
Why are you being an idiot? Thank you. That's it, blow the fucking...
Put too much in that!
I'm not there.
I said you put too much in that!
Well, I'm not surprised you turned the fucking light.
No, I didn't!
What?
No, I didn't.
What, that Franny?
No, I didn't. Ecstasy.
You alright?
I'm alright, yeah.
Well. Oh, is that hypnotising you?
Yeah.
Is that hypnotising you?
You know, no fucking was it, tell me.
Who?
Not nothing.
Slog slog.
Oh, what the fuck?
Can't do with what?
Fucking all this fucking shite.
Elvis shite?
All this fucking shite.
He's lost.
Who won the gold medal? Try shooting, mate, on gold medal.
It was that.
He had a gun.
Jabanaya.
Whatever you call it, and it comes in front of me. Easy. So far, went to fucking covers. I'm fucking trying to knock him off fucking track. Next time, fucking no.
Wacky wasted. Wacky wasted.
That bastard goes over. Oh, about paying.
He's on about monkey.
About paying for going fucking camel. Oh, what are you doing? Having food.
Do you know what you should have done? Right, no, listen to me. What you should have done, you should have phoned Quasimodo and gone back and then.
It doesn't learn to choose.
It would have been a lot cheaper.
No.
No.
It was there. Alright.
Yeah.
And where was over
So who got the hump?
there? He got the fucking hump, bro. He fucking got the fucking camel. I went, John? Was what? Your man's
It's
got
not
the
here.
fucking camel.
Oh
I
yeah.
said, I said, John, your man's got a camel.
Yeah, because you told me to, you
No, I
idiot.
didn't. You went over and never realised you had to fucking pay for the fucking ride. You dick,
I
yeah.
told you, but you weren't having it.
What do I do?
I fucking did
It was
what's going on.
in Spain. In Spain.
I want to go on that fucking
Yeah,
ride.
Jam,
Up
sorry.
to
So,
the
well, you'll have to finish
No, I
vices.
didn't finish.
You know.
I'm in Spain, right?
I'm alright now.
No,
And
yeah.
this guy had 3 camels. Right, and he kept looking at my wife.
Finish it in here.
I've finished it.
Right. I'll call it.
Yeah.
No, I need a fresh on my ears.
Wonder, that's
Yes.
wonder that.
Right.
Go on, carry on.
She says, come over to me. Kept looking at my wife. He says, how much for it, wife? Should I give you these 3 camels? Serious?
Yeah.
For your wife? I says, I don't want 3 camels. Just fucking take her.
Did you?
You went up to her. You went, honest to God.
Suck her.
No, I tried to. Yeah, I didn't. To get on my fucking nerves, I would it.
Ah.
Oh, what shit. Oh, well, never mind.
What a shit.
No, honest to God.
He weren't there.
Do it because the camel's there, right?
Well, there were 3 of them.
Look, there was one of them.
Who was that?
Oh no, who I was, there were 3.
No, they actually
Oh,
right.
No, 2 then.
There was 2, yeah, there was 2. There was one for him, one for me. But he went on, excuse me.
I told you.
Look, because I want to, there's a fair over there, like, I want to go this
Jack,
way.
you got 4 of
He
them,
fucking
because I
goes
couldn't
up
find it
fucking
anywhere.
camel. Like, paying. I said,
Paying?
right, he's on fucking camel here. He went, and his,
Jesus
and his
Christ.
mum had to pay. We went for my
No, I didn't have pay, no. No, you could have had me wife and nothing. I didn't have pay.
Went for milk, so we ended
Could have
up
had 3 camels tonight.
So we ended
And if you
up
met me, you would have gone on for nothing.
so we ended up going on these camels, didn't we? At the end,
Right.
because of him.
Do you say?
Was I didn't want to camel, I wanted fucking go fucking fur across the road. Bastard.
Right. Have you been Magaluf?
I have.
Have you?
Oh, wait a minute, you've not. So, do you remember in Magaluf when you walked into the town? Right, I don't know if you remember, they had a ride, like a bungee ride, what fucking you sat in and it shot you up.
Fucking bungee.
Do you
Jump.
remember that? Well, listen to this. I went on it, and the day after,
Ja, Roma. Ja. Nee, is je vrouw.
maar hier vrijheid zitten.
Ja, daarom.
Ja, nee, ze vinden wel.
Ja, of je terug.
Nee, nou,
En dan wat ook, wees goed.
Ja, niet hoeveel ver, niet hoeveel ver.
You went up to her! You were honest to God! Took her? No, I tried to. Yeah, I had him. She get on me fucking nerves at all with it.
Ah, was she? Oh well, anyway.
What a shit! No, honest to God. He weren't there.
Dirt, because the camel's dirt, right?
No, there were three of them.
Look, there was one of them.
Oh no, who I was were three.
No, there were three.
No, two then.
There was two, yeah, there was two. There was one for him, one for me. But he went on, excuse me.
I told you.
Look, because I want to, there's a few over there, like, on to go this
Just
way.
about four of them, we couldn't find it anywhere.
Camel, like, baying, I said,
Baying?
he's on fucking camel here. He went, and
Jesus Christ.
and his mum had the pear. We went for my
No, I didn't have pear, no. No, you could have had me laughing off it. Went to have pear.
Went for milk, so we ended
Could have
up
had three camels for now.
So we ended
But
up
if you met me, you would have gone on for nothing.
so we ended up going on these camels, didn't we? At the end.
Right.
Because of him.
Do you say?
Was I didn't want to.
What's he doing? Oh, I think he's getting it back. Oh, he's not. He was far back. He was far back. He was far back. Fluid. Far back. Fluid. Far back.
It was far back.
He was far back.
Far back.
Far back.
The country is changing before our very eyes. People queuing in the sunshine just to get into supermarkets. Many shelves empty when they get there. Government and retailers trying to calm nervous shoppers.
There is more than enough food to go round, and our food supply chain is able to expand production to cope with increased demand. In the last week, sales of some foods have increased significantly, and manufacturers have produced around 50% more food than they usually would.
There is £1 billion more food in people's houses than there was 3 weeks ago, so we should make sure we eat some of it and be considerate, and also think about other people right across your communities.
That includes NHS staff, Medics angered at stories of some of them being unable to buy food for their families.
Frankly, we should all be ashamed that that has to happen. It's unacceptable. These are the very people that we will all need to look after perhaps us or our loved ones in the weeks ahead.
NHS staff are at high risk of catching the virus. Today it emerged that 2 ear, nose and throat specialists had been admitted to intensive care.
We are very concerned that 30 to 40% of patients with COVID-19 are totally asymptomatic. That is, they appear perfectly normal. And as a result of that, our colleagues have become infected.
But this afternoon, NHS England announced an unprecedented deal with private medical providers to bring in more staff and resources, including 8,000 beds, 10,000 nurses. The country is changing before our very eyes. And today, new guidelines for doctors will rapidly published, advising them to make decisions on COVID-19 patients admission to critical care on the likelihood of their recovery. They are the kind of difficult decisions medics already have to make,
and our food supply chain is able to expand production to cope with increased demand. In the last week, sales of some foods have increased significantly, and manufacturers have produced around 50% more food than they usually would.
There is £1 billion more food in people's houses than there was 3 weeks ago, so we should make sure we eat some of it and be considerate, and also think about other people right across your communities.
That includes NHS staff. Medics angered at stories of some of them being unable to buy food for their families.
Frankly, we should all be ashamed that that has to happen. It's unacceptable. These are the very people that we will all need to look after perhaps us or our loved ones in the weeks ahead.
NHS staff are at high risk of catching the virus. Today it emerged that 2 ear, nose and throat specialists had been admitted to intensive care.
We are very concerned that 30 to 40% of patients with COVID-19 are totally asymptomatic. That is, they appear perfectly normal. And as a result of that, our colleagues have become infected.
But this afternoon, NHS England announced an unprecedented deal with private medical providers to bring in more staff and resources, including 8,000 beds, 10,000 nurses and 700 doctors. And today, new guidelines for doctors were rapidly published, advising them to base decisions on COVID-19 patients' admission to critical care on the likelihood of their recovery. They are the kind of difficult decisions medics already have to make, but soon they will be making a great many more of them.
Children who are entitled to free school meals, and we've been hearing about the decisions being taken throughout the day by ministers and by head teachers and by school staff around how they're going to safeguard children's education in the weeks ahead. But those decisions will also affect whether those 1.5 million children who usually receive free school meals will be hungry in the weeks ahead. Now, the Secretary of State for Education announced last week where he sees this programme going if we're to continue that provision for children. So we're talking about schools and their kitchens remaining open as collection points for parents to come and get food to take home for their children. But clearly he thinks that's going to take time to build up. So that's the kind of model that Feeding Britain, with our regional partners, is looking to build up in the weeks ahead. But the Secretary of State knew that that national voucher scheme, which kicks in from today for parents to redeem at supermarkets, would be an important short-term measure while that school-led solution is built up.
And what is your charity doing then to help?
So we're forging partnerships between schools and their caterers, as well as local authorities and community and voluntary sector organisations, to stitch together as comprehensive a safety net as possible to ensure that no child goes hungry. Now that, as I said, will be a mixture of collection points at the school gates or at the doors to some of our community settings, but for particularly vulnerable families, we'll have to have some kind of home delivery service in place as well. So our job at the moment is getting the food and the logistical support in place to offer that service in as many communities as we can.
Do you worry that there might be some families who fear being stigmatised by having to go to collection points?
Clearly that could be an issue. I think what we're trying to do is make it as non-stigmatised and as inclusive as we possibly can. And that would draw upon the lessons from our 5-year programme now of providing meals and activities for families during school holidays, which is particularly focused on children who would usually receive their free school meals in term time, but obviously don't in the holidays. So I think the good practice we've drawn from that programme will shape our response in the weeks ahead to ensure that nobody has to feel downtrodden or disadvantaged as a result of this system, but that they can still get food on the table at home.
Okay, we're going to have to leave it there. Andrew Forsey from the charity Feeding Britain, thank you very much indeed.
Pleasure.
Now, follow the rules voluntarily or face tougher measures. That was the message on social distancing from the Prime Minister Boris Johnson yesterday. Let's just remind ourselves of the official advice. We should remain at least 2 metres apart to keep safe. Public transport should be avoided unless it's essential. Those who can should work from home, and employers should encourage it. Don't attend public or family gatherings, whether large or small. And we shouldn't go to a GP surgery in person. Instead, we're being asked to use the phone or online services to make first contact with our doctors. NHS workers have also been doing their bit to spread the stay-at-home message. It was a point made very powerfully by one team of respiratory specialists from Belfast.
I'm Nick, and we are the Belfast respiratory team. We are now in the greatest medical crisis of our lifetime. Stay at home.
I'm Angela, one of the respiratory consultants. This is the crucial time. This is not a rehearsal. You will only have one chance at this. Stay at home.
I'm Claire. I'm a respiratory nurse. You can play your part to enable us to play ours. Please stay at home.
I'm Julian, a respiratory consultant. We all have a choice. If you choose to stay at home, you will save lives. Please, stay at home.
I'm Susie. I'm a respiratory consultant and I've been a doctor for 35 years. We are facing our greatest challenge and we're frightened. Help us. Please stay at home.
I'm Siobhan. I'm a respiratory physiotherapist. I know where my kids are. Where are your kids? Keep them at home. Stay at home.
I'm Roisin, a respiratory nurse. Doctors and nurses have died. We need to stay healthy so we can help you. You can help save our lives. Stay at home.
I'm Anne-Marie, respiratory nurse consultant. Thousands of people could die here. Help us reduce that number. Play your part. Save a life. Stay at home.
My name is Thelma. I am a respiratory consultant. You've heard my colleagues. This is a crisis. Please stay at home. We beg you.
Some stark advice there from specialists in Belfast. A leisure centre in the town of Carmarthen in Wales will be turned into a designated coronavirus ward when the virus hits its peak. Our correspondent Thomas Morgan is there for us now. Thomas, tell us more about how this is going to work.
So the council here in Carmarthen and the Health Board, however, have been in talks for some time about turning some of their areas into extra facilities for designated coronavirus patients. So what they've decided is the leisure centre behind me, just outside the town of Carmarthen, will now begin being turned into and converted into a designated coronavirus patient ward. Now, when I spoke to the council leader earlier on, he said that the aim was to have it up and running so when the virus hits its peak around May time in this area, following clinicians' advice, it would be open. But he also added if needs be and needs must and the virus progressed far worse than expected, they could get this place opened as soon as possible. This isn't the only place that Carmarthenshire Council and Hywel Dda Health Board will be adding as an extra facility, an extra ward in this area. A bowls club in Llanelli will also be converted, as will the Scarlets training facility, the professional rugby team in this area. There's been a few other developments here in Wales over the last 24 hours. The message from the First Minister was, although we've got a beautiful countryside here in Wales, now is the time not to appreciate it, but to stay home and save lives.
Okay.
Also, it's been added that those that own caravan sites and second homes shouldn't go to those, just so they don't overburden rural communities.
Thank you very much indeed. Thomas Morgan. Now, government communications have come into criticism during the coronavirus crisis, with some a lot of people won't be surprised to hear that you've been critical of the government's but you are giving them some in your blog. Just tell us what you think they ought to be doing.
Well, let me say what? If it's going to help us all. It's not in a rule. Since I've had corona, I'm not the same. I am feeling it like that. It's got the symptoms. Back in the day when you could go to the shop. Kids cannot play on the swings anymore. They knocked off the parts. Threw the key away. Nobody can go to the penny class. Oh, yeah, to see the show, the beach in Australia. Get out of my way. I'm dying for a way. No fucking fault. Roll left. Just have to wait and see. Yeah, I'm spinning around.
I'm so sorry, I'm just going to
Stay out of my freaking way. What?
Now, as the government considers tougher measures on social distancing aimed at tackling the coronavirus, my colleague Simon McCall has been speaking to experts on your behalf to answer the questions many of you have on your fight.
I need my bug roll. I need it now because wipe my face off. Trying to tell you to get out of my way. I don't want to feel you get out of my way. Interfering, bitch. I'll break you freaking down. Yes. Yes. I know you won't be the same. Yes. Stop feeling it. I'm like what? It. Right. Mystique. It. All right. X-Men. X-Miles. Cellophane. Cellophane? Yeah. Oh, I'll get some cellophane. What? You want to catch them both? Right. Yeah. You can't go outside. Let's give it up.
You like what you say? You say. You like what you say. That'll be the last record you'll ever listen to.
Keep spinning around. I'm thinking more about you, babe. Got the book like you out there. Oh, God.
Come in! Turn down the music off! What? What's happening? Oh. Is it working? I said turn it up, I said not to slow it down. You stupid jealous swine! Turn the bloody thing off! I don't like it like this. I'm glad for that. Fine! Turn the bloody thing off! It won't be the bloody same when I finish with you, you swine. But just get out of my way! Respectfully, sir, as a live. Turn this bloody music off, jealous swine. Yes. When was that love, but in the trash, it has gone dark. It's gone over. You can't go serious, I want a room. Yeah, I'll get you one. I'll get you one.
I know you can. I baby.
Get with the beat, you damn bastard. You need wings. You need the wings. What's happening? But Batman. Was it up for the bonus? Jelly gun. Yeah. Pick up my pint of Corona. Slow it down. Slow it down. Swine. 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 Buckroll! Buckroll! What's up, love? What's up, love? What's up, love? Okay. Because there's no bubble in the toilet. Macaroni. Your CV is leaking out. Yeah. I feel like go for it. Yes.
Chippy chip. Yeah.
I'm not getting you one.
Yeah.
Writing's not that easy, but Grammarly can help.
No, man.
This
Don't give me
sentence
some
is grammatically correct,
Well, we talk is so
but it's wordy and hard to read.
The world's
It
so
undermines
mad.
the writer's message. And
There's a writer's message. Right, so how's the husband? It's going so fast now. Yes, back to slow.
Hey-ya! You want me, bitch? Así para que te apa. What's Tommy doing?
Wrong song.
Yes.
I was supposed to be on Hampton Deck Show.
But I can't because I'm too
old.
And I'm mad.
I'm pissed. I see my
Yeah.
all the time.
I shine. Cry. I get it here. Fine. I got stuck.
Sam. Have a shower.
Paketik pi.
Apa ni? Siapa dah?
Ah. Kecil pun juga dong kan. Yes.
The streets are empty by the way.
Yeah.
It was the man.
Yeah. Yes. Yang kalau punya sini juga, kalau mau dibeli, yes. It's 40 back. You can always flash up with it after. See?
I will see it.
Flash up.
Oh, beneath the buckle of red. A Mother's Day.
A mother's a dog.
To go for a walk on Mother's Day.
Couldn't go anywhere cause of coronavirus. Yes. This one's better, I think. Somebody? Ada pate. Ada pate yang puas. No. Good job. Go on, Boycie. Go on, Boycie, lad. It's food processed up, you know.
It's been processed, alright.
Yeah.
Black dick.
Black dick. Oh shit. Sorry.
Was out of control.
My head is spinning with this coronavirus. Don't feel funny, don't worry. I don't know. It's going testicle wrong. I'm not like soggy lentils. I like watching the station. Yes. Now I'm being run over by the fly.
The siren ring.
I'll have a coffee, please. Yes, shut up. Don't do that, snakes will start coming. Alright.
Go for it, lad.
Oh, I'm going for it. That's for coronavirus, that.
Yeah, I know, that's what that's I can switch someone though. Yeah, I was still playing on cocaine.
Yes. Probably was.
How's that one?
getting long video that recording. Still it's finished now.
Hey, Captain Woodward!
Captain Woodward!
Where's your boy?
Where's your boy?
Shimmer Stains!
Hey! Arash! Good ass!
Captain Birdseye!
Captain Birdseye! Oh God! Oh my God! Have some Red Bull, mate.
Give the wind!
Give the wind.
Get it well!
Yes.
Glad to shoot them on cocaine.
Yes. Shoot the marigolds!
With his marigolds!
With his marigolds! With his marigolds!
Smelly goats!
Yes! I hope I get 1,000 hits with this. For next video.
I'm getting pissed. The children play bum nerds.
Huh? Yes.
Is he slowly falling off his chair?
Yeah! Falling off his chair. Yes. And fra fra.
Get him some coffee.
Yes!
There you go.
There's some coffee.
It's in it.
No. He's bloody wrong.
Yes, he's got his second wind.
Yes! He's got his second wind. No, it could get his 13th wind. 13 times. You probably do it better.
I don't do it anymore because it hurts my hand. I think we've done enough. Well, you got the first bite, please?
Yes! Get that dancer's back! Jesus Christ.
Welcome to medieval England.
Yes!
We went through my lager.
Come here. Come here, wench, with my lager, bitch. Wench, come here with my lager. Lager.
I thought you'd be forced to away something.
What do you mean?
Well, like I said, the scenes you do when you're out in the boat and not supposed to.
Oh no. Well, you have to wait and they have to get them in. So.
If you were a bunch of people, you'll fine. Or put your neck.
Well, at least they won't spreading them off. This. Praise the Lord today. Let us today have freedom.
Oh God, we're going up
Yeah. Just stuck us there.
Yes. It's finished.